بسم الله الرحمن الرحيم والصلاة والسلام على سيدنا محمد أشرف المرسلين. حبايبي أبنائي الطلاب، معاكم الأستاذة الدكتورة إيمان عبد السلام شكل Head of Removable Prosthodontic Department. حبايبي الطلاب، كلية طب الأسنان جامعة الأنطرة ليفل 5-1 إن شاء الله. معانا النهاردة محاضرة Clinical Removable Prosthodontic 3 Geriatric. Content of these lectures will be introduction about the geriatric definition, scope of the problem, psychological and psychiatric aspect of aging, aging and nutrition, oral aspect of aging, prosthetic diagnosis, prosthetic management, and I will tell summary or abstract of all the lectures at the ending. Introduction. Because we are born, we grow old, and because grow old, we die. It is unfortunate that the geriatric patient generally needs most of the necessary dental and medical service at an age when he is at least able to tolerate them and possibly least able to afford them. Although fluoridations and other preventive measures will undoubtedly have an effect on the incidence of dental caries and the resultant tooth loss of our population, the benefits to the geriatric patients of today are negligible. Definition. Geriatrics health branch of medical science concerned with the diagnosis and the treatment of diseases affecting older people, which is the study of the aging process in all its aspects, social as well as biological. Only 3.1 million, or 1 of every 25 Americans, were 65 years of age or older. This is in 1900. In 1984, 27.9 millions, or 1 of 9, fell into this category. If present population trends continue, those over 65 should account for 64.5 millions, or 21.2% of the population by the years of 2030. This is the scope of the problem. The majority of the elderly persons in their younger retirement years are relatively healthy and not limited in activity, even if they have a chronic illness. By the end of the 5th, 8th, and 9th decade of life, the chance of being limited in activity and in the need of health service increases significantly. Psychological and psychiatric aspects of aging. The problem of adjusting to old age in our society is becoming extremely difficult, owing to the high value placed on youth beauty. Members of the medical and dental profession in some cases have fallen prey to these existing attitudes, perhaps partially because of personal fears regarding their own aging process. For the aged themselves, these are frustrating years. They realize that they are beyond their productive peak, and many of their goals, ideal, ambition, and hopes can never be attained. A certain physical attribute declines, other becomes stronger. Memory may decline, but judgment may improve with age. Experience, being dependent on time, inevitably increase with age. Retirees should be encouraged to participate in creative activities as long as they are able, especially in the social, economic, and political life of their communities. Lonely patients can turn to the psychiatrists for aid in their ever-ending struggle against illness and old age. Weekly and monthly appointments can become the most significant aspect of their life. It gives them a reason for having to do something or to go somewhere, and they look forward to it. Sympathetic words when inserting danger into the mouth often does wonders. Common health problems in the elderly. Geriatric syndrome. There are many features for the elderly patient, from elderly abuse, constipation, inconsistence, falls, many things. Diagnosis with multiple causes frequently seen in elderly population. Common health problem in the elderly: cardiovascular disease. Most of the geriatric patients have cardiovascular disease, have congenital condition, have joint and bone problems, neurological disease, sight and hearing. Classification of the elderly people. Hardly elderly, many of our modern aged are in excellent physical and psychological condition. The senile-aged syndrome. These people are disadvantaged physically and emotionally and may be described as handicapped, chronically ill, disabled, infirm, and truly aged. Between these two extremes are millions of elderly. Aging and nutrition. Nutrition is one of the factors under human control that can influence the health of the aging. It is essential for the geriatric patient to retain an interest in food. He must be prevented, because of dental difficulties, from gradually changing his diet to softer foods that require little or no chewing and are easy to swallow. A reduction of fats in the diet limits the deposition of cholesterol in the arterial walls. An adequate dentition, either natural or artificial, is not essential for sufficient food intake for maintaining good nutrition balance during normal health. However, an adequate dentition, either natural or artificial, may be necessary to support the extra demands of illness and is definitely needed as an aid to the enjoyment of food. Aging and nutrition. Nutritional guidelines for the patients undergoing removable prosthodontic treatment. Eat a variety of foods. Build a diet around complex carbohydrates. Eat at least 5 servings of fruit and vegetable daily. Select fish, chicken, lean, eggs, or dried peas and beans every day. Consume 4 servings of calcium-rich food daily. Limit intake of bakery products high in fat and simple sugar. Limit intake of prepared and processed food high in sodium and fat. Drink several glasses of water, natural juice, and milk daily. Risk factor for malnutrition in patients with dementia. Eating less than 2 meals per day, difficulty chewing and swallowing, a planned weight gain or loss of more than 110 in the last 6 months, undergoing chemotherapy or radiotherapy, alcohol or drug abuse, unable to shop for cook for or feed oneself. Carbohydrates should comprise 45 to 65% of total calories, fat, protein, and fluids. دي جزء مقدمة للإيجينج بتعريف الإيجينج ونسبة الإيجينج all over the world بالأعمار بالأمراض اللي هم الإيجينج الشخص اللي هو فوق 65 كلهم ممكن تلاقي عندهم bone disease, cardiovascular disease, different diseases and the effect of malnutrition for these patients even if they are wearing artificial dentition, wearing dentures or with natural teeth. This is an introduction. Now we are start of my lectures, geriatric for you as a student. Before ده جزء معلومات introduction حاجة عشان تفهموا الايجينج ايه ونسبته ايه والقصة دي كلها انما انتوا من بداية الاورال aspect of aging هذا هو المنوط بيه ان انتوا تعرفوا. oral aspect of aging في loss of teeth في attrition paroxysm oral mucosa loss of elasticity atrophy hyperkeratosis. About the gingiva loss of stippling tissue friable easy injured recession. About the tongue, atrophic glossitis, vitamin B complex deficiency. About the lips, angular cheilitis due to dehydrations. Also, about because of the loss of the teeth and become edentulous, the lower 1/3 of the face become decreased. And you can look for, remember, the effect of decrease in vertical dimension. Angular cheilitis is one of the effect of decrease in vertical dimension. Alveolar bone flabby, the alveolar ridge may be knife ridge, may be flat, may be flabby, like this. Bone. Saliva, diminished function of salivary glands with relative or absolute xerostomia due to atrophy of cells lining the intermediate ducts. Xerostomia also results in abnormal taste sensation and stomatodontia. Here, for the patients, for the aging patients, before coming to start for diagnosis, treatment, planning like this to do complete dentures, you must see that there is effect on the oral mucosa and the skin. There is effect on the bone and the maxillomandibular relation. It changes. There is effect on the tongue. There is effect on the loss of taste. There is effect on the salivary gland as a result of xerostomia. Because all these have the effect on the success of the dentures. The effect also in temporomandibular joint and the facial muscles. You must know that the patients at this age, he will come with all these changes. And we must understand how to manage with every aspect of changes and correct it. For prosthetic diagnosis, contrary to the belief of many patients and some dentists, the loss of teeth is not a consequence of growing old. Unfortunately, there are many in the dental profession who are radical in their attitude toward the elderly. Even when the loss of all remaining natural teeth are inevitable, they are too quick in diagnosis complete dentures. Although the patients no doubt will adapt better to complete denture at an earlier age. Construction of partial, transitional, or overdenture is the treatment of a choice. It is better to retain the natural teeth for as long as possible and eventually accept the complete denture with their decreased efficiency. هنا في الحالة دي لازم احنا نكون واخدين بالنا ان المريض وهو عندك خصوصا المرضى اللي هم دينتال لما بيروحوا للدكتور الأسنان هنا انت بتتابع المريض. you must help him to keep his natural teeth even if you do partial, do transitional, do over denture, to try to keep. Lastly, if the negligence of the patients will lead for the patient become completely dangerous. So in this way he will be for complete denture. The longer the patient retains some of his natural teeth, the shorter the time he will be dangerous and better residual ridge will be. كل ما المريض بيهتم وبيتبقى من الأسنان الناتشورال عنده، the shorter the time will be dangerous، هيبقى أقل مدة إن هو يبقى dangerous، ويبقى في عندنا better residual ridge. لأنه لو هو خلع سنانه من بدري and he use his dangerous ridge without doing dentures for his dentures, there will be flat ridge, and this is not good for the patients. But if he retain his teeth, no resorption for the dentures ridge too much, so there will be good prognosis when you do complete denture for him. Patients' motivations cannot be underestimated. The patient must realize his need for prosthetic treatment, want denture, accept the procedure and attempt to learn it. لازم البيشنت يقتنع احتياجه للعلاج التركيبات، وإن هو محتاج الدنشر، ويوافق على البروسيسز، ويحاول إن هو learn to use هو يستخدمه. The dentist in turn must adapt his technique. لازم الدكتور إن هو يشوف التكنيك اللي هو يناسب هذا المريض. Perhaps changing his original diagnosis as a treatment progress and to concern himself with the construction of a functional and comfortable procedure. لأن كل المرضى اللي هم الإدنشرس الجيرياتريك بيشن بيختلف التكنيكس في الشغل، إنك أنت في الإند تديله complete denture كويس وسكسس وناجح. Many times nothing is as important as good clinical judgment in prosthetic diagnosis for the geriatric patients. Complete denture shouldn't be constructed if a patient is under extreme physical or mental stresses. طبعا احنا عارفين في انواع كتيرة من المرضى لما تيجي تعمل الدايجنوزس لهم، في ناس accept الشغل ويبقى فيه cooperative من المريض، في ناس ان هم ما بيرضوش ان هم زي السايكاتريك والمنتالي اتيتيود بتاعتهم، وهم بيبقوا uncooperative ان هم يساعدوا الدكتور في نجاح هذا العمل. في ناس اساسا passive، هو مش حابب ان هو الشغل ده يتعمل له، وان هو ما يبقاش عنده النية ان هو يستخدم الشغل ده والطقم ده. خدت بالكم؟ في ناس بتبقى unexpected للشغل والتكنيك اللي بيتعمل، وما هماش حابين الكلام ده ان هو يتعمل لهم. فهنا الاتيتيود بتاع البيشن مهم جدا لنجاح الدنشر ويبقى موجود معاه. طيب في ايه هنا تاني؟ satisfied wearer denture of all denture، الناس اللي هم عندهم satisfaction ان هم ايوه عايزين نلبس طقم. The majority of practicing dentists have probably seen wearer of all the denture with acrylic denture that actually float in the patient's mouth. It is an error to try to talk to these geriatric patients into having new denture. طبعا في عندنا نوعية من الناس ان هي ممكن تبقى satisfied wearer of all the denture. الناس ديت بيبقى عندها طقم، والطقم ده ممكن يكون بيتحرك، ما هواش retentive، ولكنهم سعداء بيه جدا، وانه هو برضو في ابحاث كتيرة عملت للالكترو مايجرافيك اكتيفيتي للمسلز مع وجود الدنشر دي، فبيلاقوها انها بتبقى كويسة والاكتيفيتي بتاعتها كويسة. طبعا هو الدنشر هنا هو نون ريتنتيف وبيتحرك وبيدي افكتيف في الماستيكيشن. هو شغال بالماسل كنترول، ان هو قد التشيك والباكسينيتور ماسل والاوربيكولاريس اورس ماسل والتانج فروم انسايد كلهم بقوا يعملوا زي سيتنج افكت له في الفانكشنز. فهنا المريض هنا علشان تقول له شيل الطقم القديم ده اللي هم satisfied wearer of old denture وهعمل لك طقم جديد، even لو انت عملت فيه كل الشغل اللي هو يخليه ريتنتيف وستابل والقصه الاستابيليتي والقصه دي، هم هيبقوا مش satisfied بالنيو دنشر، هم satisfied بالاولد دنشر. في نوع اخر من الجيرياتريك بيشنت doesn't want اللي هم doesn't want denture. The geriatric patient مش عايزين طقم. An elderly person who has been without teeth for many years and has no desire for complete denture is best left alone. لو هو راجل كبير في السن وقاعد مدة طويلة بدون سنانه وبياكل ويشرب وعايش حياته كده، هو ما بيحبش إن هو يتركب له طقم سنان. If facial appearance is unimportant to these patients، يعني هو أساسا خلع سنانه، فطبعا اللور 1/3 of the face بيبقى قليل، الفيشال appearance بتاعه والايجنج بتاعه بيبقى باين جدا. الراجل ده غير مهتم جدا بالاثيتيك ولا الابيرنس بتاعته. هو بياكل بالالفولار ريدج اللي هو الريزوربت اللي بقه وتمام ومقتنع. If facial appearance is unimportant to these patients and being without teeth doesn't alter their personalities، يعني هو الappearance بتاعه ده مش مؤثر على البرسوناليتي بتاعته. It is an error to convince them to have complete denture concern. من الصعب جدا انك ترغمه انه لازم يعمل complete denture، طبعا مش هيبقى cooperative. في هنا older patients are often more irritable and demanding than younger patients. خلي بالك هنا جيمسون قال ايه؟ as the fitting the personality of the aged patient is often more difficult than fitting a denture to the mouth. يعني انت تظبط الشخصية بتاعة الaged patient الحاجة اللي هو عايزها ديت أصعب عن إنك أنت fitting الدنشر للماوس بتاعه. الأولدر بيشن دايما الناس الكبار في السن بيبقوا more irritable، بيبقى عندهم في شيء من القلق والطلبات الكتيرة عن اليونجر بيشن. Geriatric patients should not be promised too much. ما تقعدش في السن إنك أنت تمليه أو تفهمه إن هو هيلاقي من الدنشر، لأنه هو لو ما لقاش هذا الكلام ده بيبقى له فيدباك وحش له. Aesthetics. It has been written and said many times that aesthetic is unimportant or secondary to fabrication of the denture for the age. الناس اللي كبرت قوي في السن الaged patient الاستاتيك دي secondary demand لهم، يعني المطلب الثاني ما هواش important قوي. Although we know that dentures can improve the facial appearance، ولو ان احنا عارفين ان من ضمن الاوبجكتيفز بتاعه الكومبليت دنشر في الادنشلس بيشن ان هو الاثيتيك والابيرنس، لانه هو بيصلح امبروف الفيشيال appearance، لكنه هو السكند. If the final dentures are not what the patients want or expect aesthetically, they may be immediately rejected. لو البيشنت متوقع aesthetic dentures بتاعه هيبقى بصورة معينة وما لقاش الاesthetic appearance اللي هو منتظره هيرفض immediately على طول الdenture. If the patient cannot be convinced to accept the denture on aesthetic ground, improved function and other features should be stressed. Prosthetic management fixed better than removable. طبعا انت لو هو عندك مش completely هو partially dangerous طبعا هم هيفضلهم الفيكس. Implant much better to patients but it depended on systemic condition. طبعا الناس اللي هم الكبار في السن لو هو مش completely dangerous في الحالة دي هو بيفضل كمان الامبلانت او ان احنا نعمل له الاوفر دنشر. خدت بالكم ده على اساس ان الميديكال هيستوري بتاعه بيسمح بهذا او السيستميك كونديشن بتاعت البيشنت بتسمح بهذا التايب اوف. فور كومبليت دنشر الطقم الكامل العادي اللي احنا بنشتغله impressions. Prior to making a dentures impression for geriatric patients, the denture bearing tissue must be thoroughly examined. قبل ما نبدأ ناخد لازم نعمل examination زي ما احنا عارفين في الكومبليت دنشر من البداية بناخد الهيستوري dental وميديكال هيستوري ونعمل examinations والقصة دي كلها. The finished denture should be as large as possible within the functional limitation of the patient with no impingement on the functional border. طبعا هنا في الكومبليت denture لازم أغطي الماكسيمم لاند ماركس ويبقى عندي ماكسيمم coverage عشان ألاقي retention وألاقي stability والقصة دي كلها without إن هو يبقى فيه impingement على الfunctional border during البريفري بتاعته طويلة. In vertical dimension, the determination of vertical dimension in a young healthy individual is difficult when the geriatric patients much more time and the efforts are required to ensure an accurate physiologic recording. The interocclusal distance increases with the age. Now we know that the interocclusal distance increases with age. Geriatric patients need more than the average 3 mm interocclusal distance of the young adult with a full complement of teeth. Falling in of the lips due to loss of adequate support and muscle tone complicates the difficulty of determining a vertical dimension. If severe difficulty existed in the determination of vertical dimensions, the patient's old denture is available can be used as a guide. In some elderly patients, even though the vertical dimension is carefully and to the best of our knowledge correctly determined, clicking of the denture may still occur because of the muscular incoordination or habits. For the centriculation, the correct recording and the duplication of centriculation is of paramount to the success of complete denture. Prognostic position of the mandible with the resultant convenient eccentric bite is often acquired by the geriatric patients, usually with the result of closed occlusal vertical dimension. We know that when the patient becomes completely dangerous, he cannot bite the food. So he tried to protrude his mandible in front to be in approximation with the anterior portion of the ridge of the mandible with the upper for helping him to bite. This is for the first time become confidence. The patient is conscious to this action, but with time become unconscious and the mandible protruded على طول لقدام. So with time he become like these cases. So you must important to retrude the mandible to centric relation. Try him by the method in the centric relation discussed before. The patients must be seated in upright position if at all possible before centric relation can be recorded. Although many prosthodontics recommend Gothic arch or arrow-pointed tracing for determination of centric relation of the elderly. We know for the recording the centric relation, we have interocclusal record or cheek bite method record, and we have Gothic arch for graphic tracing. This is an accurate method used for recording the centric relation, and it can be used for check the record done by the cheek bite or the interocclusal wax wafer method. Posterior teeth selection. The posterior teeth are responsible for the occlusion of a complete denture. Arrangement of the posterior teeth plays a significant part in the retention and stability of the denture and the condition of the supporting tissue. Many prosthodontics recommended 0-degree posterior teeth for the dangerous geriatric patient and prefer to be acrylic teeth. We have 3 types of teeth. 0-degree teeth اللي هي non-anatomic or non-cuspid or monoplane cuspid teeth. This is better for the geriatric patient. And we have cuspid teeth and we have semi-cuspid teeth. So we select the 0-degree teeth better for the geriatric. You can select porcelain or acrylic. I prefer acrylic because it acts as a cushion for the force transmitted to the edentulous ridge under the denture. Several non-anatomic modifications of the posterior teeth forms constructed wholly or partially of chromium cobalt alloy are available that are claimed to be advantageous for patients with less than average clothing pressure, and where it is necessary to reduce the force of the denture on the peering surface during function. Hardy has designed blocks of upper and lower acrylic posterior teeth in which curved metal cutting blades are embedded. This is types for the posterior teeth to allow better biting and cutting for the food. Semi-anatomic, the other semi-anatomic teeth, and we have ال IPN اللي هو cross linked acrylic teeth اللي هي الابريفيشن بتاعتها interpenetrating network copolymer acrylic teeth. This is have a harder type of the teeth, more abrasion resistance, more heat resistance. It is good because we have porcelain and have the advantages of porcelain. We have acrylic teeth and have the advantages and disadvantages also. But the IPN combine both advantages of the porcelain and the acrylic teeth. Adjustment, no matter how much care and skill are incorporated into the fabrication of complete denture, their insertion is usually followed by irritation and trauma in varying degree. The soft tissue pain threshold changes greater with aging, with an increase in the sensitivity, which, according to Benton, frequently reaches to magnitude of 400%. Geriatric patients should be seen the day after insertion or at least the second day. لازم المريض في follow up after الانسرشن وبعد ما نديله الطقم ونقول له الادفايس في استخدام الطقم to be seen after day of insertion or second day. If the patient is a new complete denture wearer إذا كان هو شخص لسه أول مرة بيلبس طقم mastication shouldn't be attempted until the denture can be worn comfortable. ما نقدرش ان احنا نوعده ان هو ياكل بيه تمام لحد ما يبدأ ان اي complaint بتظهر انها to be adjusted and corrected وان هو يبقى wear الدنشر comfortable يقدر يبقى فيه mastication كويس. And the speech presents no problem. During the adjustment visits, the patients should be asked for pointing our areas of soreness. في المرة اللي هو يجي المريض نشوفه لازم يقول لنا على المناطق اللي هي مسببة له. However, patients are poor judges and usually cannot locate exact area of discomfort. المريض نفسه بيشاور لكنه مش عارف ال exact area of discomfort المنطقة اللي هي مسببة له الألم أنه. Geriatric patients can remove one or both dentures during the day if their mouths feel tired after the adjustment period. If the patient is unable to care for his denture or is afraid to try because of the fear of dropping and breaking them, oral hygiene of the denture will be entirely dependent on another person. طبعا إذا كان المريض كبير أوي في السن ومش قادر ان هو يبقى فيه كير للدنشر او خايف ان الدنشر يقع منه يتكسر هنولي الاورال هايجين بتاع الدنشر بتاعه dependent on another person يبقى فيه شخص اخر هو اللي take care معاه. If the dentures of the geriatric patients must be relined لازم ان احنا نعمل له relining because of the inability of the dentist to construct new dentures for any reason. ممكن الدنشر القديم اللي هو موجود عند المريض ده والمريض ده لو هو في حالة ان احنا ما نقدرش نعمل له نيو دنشر اقدر انا اعمل له ريلاين للدنشر بتاعه واظبطه له For the summary for these lectures, number of aging patients increase rapidly in our society, so dental care of the aging patient presents a number of problems not encountered in younger patients. Most of these problems result from tissue changes that occur during aging the dentist, especially the prosthodontist. It is a strategic position to evaluate and correct many of the dietary and nutritional deficiencies that promote premature aging of the tissues. طبعا الناس اللي هم with time becoming Asians والقصة دي احنا بعمايل بتقع القصة دي على البروستودونتيك التركيبات بحيث ان هم يقدروا يصلحوا الدايتري والنيوتريشنال ديفيشنسي العجز اللي بيبقى في الوجبات وفي طريقة الأكل بتاعهم علشان ما يبقاش عندهم premature aging of the tissue تعجيز بدري للإيه بتاعتهم. المحاضرة أشكركم وإن تبقى فيه إن شاء الله استفادة من هذه المحاضرة. في هاند أوت أنا مديهولكم الحمد لله بتقدروا تقروا المحاضرة في الهاند أوت وعندكم الباوربوينت الجزء الأولاني مديكم انترودكشن عشان يبقى عندكم باك جراوند للإيجينج all over the world نسبته إيه وأخباره إيه وبيؤدي إلى إيه. من أول الجزء اللي أنا أشرت عليه في السلايد وأنا بدي المحاضرة عن بداية الأورال أسبكتس للإيجينجز بيبقى شكله إيه واللاين اوف تريتمنت كبروستودونتيك بنشتغل الناس للايجنج دول بيبقى الشغل عامل ازاي. ارجو انك انتوا لو في اي اسئله في اي questions no problem to feel free contact to me عن طريق الايميل او بالتليفون او باي حاجه. انا حابه ان اي حد يعوز اي حاجه ان انا اقدر اساعده باذن الله. ان شاء الله ربنا يزيح الغمه دي ونرجع نتقابل مره اخرى وكل سنة وانتم طيبين. دكتورة إيمان عبد السلام شكل رئيس قسم الاستعاضة بجامعة الأنطرة. السلام عليكم.